Now let's take a look at epilepsy. Epilepsy is a group of neurological disorders and characterized by recurrent epileptic seizures. These are also in layman language, these are known as attacks or fits. Epileptic seizures are episodes that can vary from brief and nearly undetectable periods to long periods of vigorous shaking. It is a result from paroxysmal uncontrolled discharge of neurons within the central nervous system, that is the gray matter of your brain. These episodes can result in physical injuries, including occasionally broken bones. It affects almost 50 million people worldwide. 4 to 10 people out of 1,000 suffers from epilepsy. Epilepsy is a disorder characterized by recurring seizures, also known as seizure disorder. A seizure is a brief, temporary disturbance in the electrical activity of the brain. The seizure is a symptom of epilepsy. It is more common in older people. It is controlled in 70% cases by medication. Those who do not respond to medication are treated with surgery. Medication is not a complete cure to this type of disease. Risk factors include mental retardation, cerebral palsy, Alzheimer's disease, stroke, and autism. The cause can be unknown or it can be due to brain injury, stroke, trauma, tumors, or birth defects. Signs and symptoms involved. Epilepsy is characterized by a long-term risk of recurrent seizures. Depending on the area of the brain involved, seizures are as follows. Convulsive seizures. Convulsive seizures is again classified. The first type is generalized seizures. Here, in generalized seizures, there is uh, affect affection. Both the hemispheres of the brain they are affected. It happens without warning. There is complete loss of consciousness. It is again classified into 6 types. First one is tonic-clonic seizure. Second is tonic seizure. Third is clonic seizure. Fourth is absence seizure. Absence seizure mostly occurs in small children. Fifth is myoclonic seizure, and sixth is atonic, or it is also called as akinetic seizure. Next type of convulsive seizure is focal seizures. It affects one hemisphere of the brain and it may or may not progress to both the hemisphere. It is preceded by some auras, that is warning. It can be a sensory like visual, hearing or smell, or it can be psychic, autonomic or motor phenomenon. The second type of seizure is non-convulsive seizures. There is decreased level of consciousness and which lasts for 10 seconds. Now we'll see generalized seizures, generalized clonic convulsive seizures. The first type is tonic-clonic seizure. It is also called as grand mal. This seizure lasts for almost 2 to 4 minutes. It begins with a loud cry before the person falls unconscious on the ground. The, the cry comes out due to the contraction in the chest felt by the patient. The tonic-clonic seizures occur with the contraction of the limbs followed by their extension along with arching of the back. You can observe in this picture that the back of the person is arched. This phase is known as the tonic phase. A person often turns blue as breathing is stopped. In clonic seizure, there is shaking of the limbs in unison. After the shaking has stopped, it may take 10 to 30 minutes for the person to return to normal. Loss of bowel or bladder control may occur during a seizure. The tongue may be bitten at either tips or on sides during a seizure. Mostly the tongue is bitten on the sides. After the person regains consciousness, he may have difficulty in talking, walking. He may complain of headache, muscle ache, weakness in arms and legs. So these are the stages of seizures. The second type of seizure is absence seizure, which is also called as petit mal. It begins at the age of 4 and stops when the child is at adolescence. There is a brief period of loss of consciousness. The person becomes quiet. He may stare or blink or roll his eyes or move his lips. It lasts almost for 15 to 20 seconds. On recovery, the person does not remember what happened and he continued to do what he was doing earlier. If left untreated, it might progress to grand mal. The third type is the myoclonic seizure. There is a brief involuntary spasm of the tongue, muscles, face, arms, legs, or all over. There is the fourth type is atonic or akinetic seizure. It occurs in young children. Without warning, a child abruptly loses consciousness, collapses, and falls to the ground. There is no convulsion, but children may hit their heads as they fall after a few seconds. The child regains consciousness and can stand and walk again. The fifth type is the clonic seizure. Clonic seizure begin in early childhood. During a clonic seizure, a person may lose control of bodily functions and begin jerking in various parts of the body. He or she may temporarily lose consciousness, followed by confusion. The sixth type is the tonic seizure. Tonic seizures most often develop in childhood, although they can occur at any age. Tonic seizures are characterized by facial and truncal muscle spasm, flexion or extension of the upper and lower extremities, and impaired consciousness. Pathogenesis. The 19th century neurologist Hullings Jackson suggested a sudden excessive disorderly discharge of cerebral neurons as the causation of the epileptic seizure. The resistance of the excitatory neurons to fire during this period is decreased. GABA, gamma aminobutyric acid, is a inhibitory neurotransmitter. It is suggested that the levels of GABA is decreased in such persons. This may occur due to changes in the ion channels or inhibitory neurons not functioning properly. After mechanism of epilepsy, Another mechanism of epilepsy may be the upregulation of the excitatory circuits or downregulation of the inhibitory circuits following an injury to the brain. Recent studies in animal models of focal epilepsy suggest a central role for the excitatory neurotransmitter glutamate. It is increased and inhibitory gamma aminobutyric acid is decreased. Diagnosis is dependent on the symptoms, sign and symptoms shown by the patient. If your physician suspect you have had seizures, he may suggest you have an electroencephalogram EEG test. EEG measures the electrical activity in the brain. This test may help determine seizures by locating the source of any abnormal activity that may cause seizures. Other tests include routine investigations of hematology, biochemistry, electrolytes, urea and calcium, neuroimaging techniques like CT scan, MRI. Advanced investigation includes PET, SPECT, etc. Treatment involves use of anticonvulsants. In intractable cases, surgery may be necessary. The commonest drugs which are used are first line drugs involves carbamazepine, sodium valproate, lamotrigine, levetiracetam. Second line drugs include topiramate, pregabalin, zonisamide, carbazepine, reticapine. Basic rules for drug treatment includes drug treatment should be simple, preferably one anticonvulsant should be started, and slowly there has to be increase in the dose, and then you can add on second therapy, second drug. Vagal nerve stimulation, it is a device is implanted to control the seizures by delivering electrical stimulation to the vagus nerve in the neck, which release impulses to widespread areas of the brain. It is used to treat partial seizures when medication does not work. The first aid that we have to follow when we see a person suffering from seizures is you don't have to crowd around that person. Only single person has to help him. You yourself have to stay calm. You have to make sure that the place is safe. If the person is falling on the ground, you have to see that he does not get hurt. You have to help him to lie down. Note the time when the seizure starts and when it ends. Stay with that patient, cushion their head with something soft. After the seizure has stopped, put them in the recovery position. Stay with them until they are fully recovered. If you find that the person is choking, you have to give him external breathing. Don't hold the person tightly. Don't put anything in the mouth of that person. If the seizure doesn't stop after 5 minutes, call an ambulance. If their breathing sounds difficult after seizure has stopped, call an ambulance. So this was all about epilepsy. Thank you.